When a child grows up, you have to see that his weight and height are being maintained properly. What is called road to health card. All primary health centers are supposed to maintain it. All children born are supposed to register with them, and they are supposed to monitor the growth and development of every child. And the weight and height gain is crossing the say the 25th percentiles on either side, then something is wrong. Either too much of weight or too slow height gain. These are all important signs of some serious disease process going on. And the assessment, developmental assessment also, there are provisions to get it freely. Actually, each district is supposed to have a psychiatrist, and 1 in 3 districts are supposed to have a child psychiatrist. That's how it has been planned, and that's how the number of posts have been created, etc. But of course, there are lacunae and gaps, as in health sector as well as as is seen in every other sector. So until all those comes, at least you can make sure that your own child's mental, motor, and social development are going along the expected lines. Yesterday we talked about the importance of emotional quotient as well as intelligence quotient. Once in a while, it's good for all of us to undergo both these IQ and EQ tests to know where we stand, to get a better idea about ourselves, so that we know what's not ideal with us and what we can do to work towards improvement in ourselves. All people above 18 years, as young as 18 years, should undergo BP and weight checkup periodically. Periodically means it's quite arbitrary, but at least once in 2 to 3 years. Check the BP and weight. You shouldn't be losing too much of weight, you shouldn't be gaining too much of weight. And BP, blood pressure, blood pressure checking is not something to be done only in people after the age of 50 or 60. We see young people with 30, 35 coming with heart attacks, with strokes, and check the BP, they are shooting 200 by 180, 150, 200 by 160. These are very, very common. And there are very simple reasons many a time. People with the thyroid hormone high levels having high blood pressure, people with some other endocrine problem, people having a renal artery stenosis, coarctation of aorta. There are lots of reasons, or aortic incompetence. Many causes are there. And sometimes you diagnose a person has got a serious chronic renal failure. Kidney is one of the kidneys, plus a little bit of the other kidney is not working. First time by seeing a very high blood pressure. So please, all of you, even young people, please do keep checking your blood pressures. And blood pressure checking, again, it's not a single reading. BP always keep changing. If you are excited, if you do exercises, or if you see a dream immediately afterwards, there are a lot of physiological conditions which change your blood pressure. So you go to your doctor, sit down there for at least 10 minutes, be calm, and he has to examine your blood pressure at least 3 times and take an average of it. At least an average of 3 blood pressures is a must to get some idea of what's the actual blood pressure. And again, this should not be confined to one day. What is ideal is that it's not very important that the best cardiologist take the blood pressure. That's too stupid. He seldom has and he's so old that he may not even be able to hear the crotco sounds that the stethoscope is able to carry from the heart to the ear. So it's important that a young person with good hearing properly examines you. Even a trained good nurse is enough. But she has to take it 3 times and take an average, and she has to do it 3 days consecutively and take an average. That's only what will give some idea of what is your sort of an average blood pressure like. Going just by a single blood pressure, and if it's high, immediately starting antihypertensive drug, or if just a single blood pressure is normal, the patient is happy, okay, my BP is normal, then I won't go again, because if he again detects that some BP is high, I'll have to start taking antihypertensive drug. This kind of procrastination and trying to swallow only the information which immediately satisfies our mental state, that's a very dangerous situation. So if you want to know your blood pressure, at least let somebody do it 3 times. You find out somebody who has the patience to do that at least 2 times, and at least 3 days of a week, so that you all know that, okay, this is the sort of blood pressure I'm having. It's not that very important for sugar and all. Sugar, you can actually do a fasting blood sugar and a random sugar or a postprandial sugar after ഭക്ഷണം രാവിലെ എഴുന്നേറ്റ് ഉടനെ ഭക്ഷണം കഴിക്കുന്നതിന് മുമ്പുള്ള ഒരു ഷുഗർ, അതുമായി ഭക്ഷണം കഴിച്ച 1.5 മണിക്കൂറിന് ശേഷമുള്ള ഒരു ഷുഗർ. ഇപ്പൊ രാവിലെ എഴുന്നേറ്റുള്ള ബ്ലഡ് ഷുഗർ ഇപ്പൊ 100-ൽ കുറവും ഭക്ഷണം കഴിച്ചതിനുള്ള ബ്ലഡ് ഷുഗർ 150-ൽ കുറവാണെന്ന് വെച്ച് കഴിഞ്ഞാൽ ഡയബറ്റീസിലാണ് ഏതാണ്ട് വളരെ കോൺഫിഡന്റ് ആയിട്ട് നമുക്ക് ഇരിക്കാം. പിന്നീട് ഓഫ് കോഴ്സ് ദാറ്റ് ഷുഡ് നോട്ട് ബി ദ end of your checks. You should do these checks periodically, at least once in 2 years. And above 45 years, it's so very important to do that frequently. And in women, as young as very young age, 21 years onwards, up to the age of 65 years, that's the time when the cancers of the uterine cervix, ഗർഭപാത്രത്തിന്റെ ക്യാൻസറുകൾ ഈ 21 വയസ്സ് മുതൽ 65 വയസ്സ് വരെയുള്ള ആൾക്കാർക്കൊക്കെ കണ്ടുവരുന്നു എന്നുള്ളതാണ് യാഥാർത്ഥ്യം. അപ്പൊ ഒരു അറ്റ്ലീസ്റ്റ് 3 വർഷത്തിലൊരിക്കൽ നമ്മൊരു ഇത് ചെക്ക് ചെയ്യുന്നതാണ്. പാപ് സ്മിയർ എന്ന് പറഞ്ഞാൽ വളരെ സിമ്പിളായ ഒരു നോൺ ഇൻവേസീവ് ടെസ്റ്റ് എടുത്ത് സൈറ്റോളജിക്കലായി സെൽസിന്റെ സ്റ്റെയിൻ ചെയ്ത് നോക്കുന്നതാണ്. That particular test, at least once in 5 years minimum, all women of the childbearing age up to the age of 60. After 65, usually the cancers of the cervix, etc., are extremely rare. And similarly, mammography, breast cancer detection. Also, after the age of 40 years, the recommendation is once in 2 years, everybody should do mammography. That's the World Health Organization's recommendation. That's not always possible. So, what is thought is that women should do self-examination of the breast. And there are, if you go to any district headquarters hospital and ask for information, they are supposed to provide you free the cancer prevention and counseling section. They give you free booklets to show how every woman can examine their breast to look whether there are any masses, etc. We should immediately alarm them to go to a surgeon and to do further investigation like mammography and other further test biopsies, etc. if necessary. So this also should be a routine practice after the age of 40 years. Similarly, men after 50 years, one of the important cancers to be worried is the colorectal cancers. Any bleeding after the age of 50 years should be taken. It should not be always thought of and dismissed as common piles. Could be the beginning of a very serious cancer, one of the very important cancers of the men, and of course they do occur in women also. And this can be detected by simple examination, proctoscopy, and that kind of examination. And some of them present like piles actually. So all piles are not benign. There can be cancer-related piles also. So we have to take care of it. After the age of 60 especially, all of us lose a lot of calcium from the bones and the bones becomes very brittle. You fall after 60, after 70, the chance of getting a fracture is very high. After the age of 70, somebody falls. The fracture of the neck of femur is a very, very common problem. And hence, there are bone scan tests to do after the age of 60, 70s. All of you must undergo after the age of those who are above the age of 60s and 70s, especially above 70s. Especially if you get pains deep inside your limbs, you must undergo these bone scans to see how much of the calcium is in your bone. And if you see it low, you must take calcium and vitamin D. Vitamin D is not a vitamin which you can keep on taking too much because it's a fat-soluble vitamin. All fat-soluble vitamin, vitamin A, D, E, K, unlike B and C, which are water-soluble vitamins, you cannot take it without any check because they accumulate in the body. They are not washed away through urine. Whereas B and C, any amount you can take, excess will be washed away. So if only there is an indication, you must keep on taking it. But having said that, pregnant women, people who are after the age of 70 years, they all lose a lot of calcium and they do need routine. There is no harm in routinely taking vitamin D and calcium.